G'day everyone, and thank you so much for having me. It is an absolute pleasure to be with the International Congress for Qualitative Research Theories and Methodologies for this 2024 conference. Before I begin, I'd like to proudly acknowledge the Awabakal, Wonnarua and Darkinjung people whose lands I live and work on. On behalf of CQUniversity, I pay my respects to their ancestors and their descendants who continue cultural and spiritual connection to country. I'd like to recognise their valuable contribution to Australia and global society. So, hello, my name is Dr. Amy-Louise Byrne and I'm a Senior Lecturer and Postgraduate Research Coordinator with CQUniversity's School of Nursing, Midwifery and Social Sciences. I'm a proud and passionate nurse and my research centres on nurse-led models of care, rural and remote health, Aboriginal Torres Strait Islander health equity, and more specific for today, critical inquiry. My presentation today is Behind the Curtain, Critical Discourse Analysis in Healthcare, Power, Equity and Opportunity. So today's presentation will cover, will basically be a beginner's guide or a bit of an overview to critical discourse analysis, walking you, the audience, through what CDA is, how it is conducted, why you might choose CDA and the outcomes and opportunities it allows for. I will be available during the presentation because this is a pre-recording to answer any questions, and I encourage your thoughts and insights as we dive into this methodology. So let's get started. And first I wanted to start by doing some framing of critical discourse analysis, or CDA. So philosophical framing of CDA is largely Marxist and from the critical social theory school of thought. So looking at this diagram here, I'm sort of looking at this sort of right-hand side column. So stemming from the Frankfurt School, in the 1920s, that sort of post-World War I, moving into the Second World War, critical social theory rose in response to power and justice, or injustice, particularly seeing this as a socially and historically driven process. Ultimately, critical social theory is a worldview that challenges the ideas of a singular truth. There is no one truth. The human experience is fundamentally a social one, and we are all guided and moulded socio-politically through the influences and the purposes that we find in life. So you can see here, and I'm going to, in a future slide, talk a little bit about the key players in CDA, but there are strong links with those sort of Marx, critical social theory, and in particular, Foucault. I'll talk a little bit about him because the literature does say that Foucault is the theoretical godfather of critical discourse analysis. So Foucault was in many ways an activist and a rebel. He is a French philosopher from the post-structuralist school who believed that any given subject is the product of historical, social, and political influences. Foucault argued that discourse is a way of constituting knowledge and social practice, and it is this which CDA often builds upon. So just to reiterate, Foucault states that any given truth in society is the product of its environment, its history, and its power relations. Persuasive forms of coercion exist where people do not necessarily see them, meaning that the world around us is seen as true and correct, yet we're often unaware of the power relations and the history behind our structures and our social orders. Therefore, we are all actors within society with our defined roles. I'm going to give you some examples a little bit later throughout the presentation, but you might like to start thinking about some of the roles that you assume within society. In this way, language makes people and people make language. We are all products of our discursive and socially formed worlds. So what is critical discourse analysis? So CDA, being part of that critical social theory family, it is a socio-political, conscious and oppositional way of investigating language, discourse and communication. So in describing CDA, I rather like Fairclough's definition, who states that discourse analysis aims to systematically explore often opaque relationships of causality and determination between discursive practices, events, and texts, and the wider social and cultural structures, relations, and processes. So the relationship between the text and the actual social practice. So text becomes a direct representation of the world, while also further perpetuating meanings and truths. In line with this, CDA aims to uncover persuasive coercions of power relations within the language and the ideology of text. And that's done through investigation of conventions behind the texts, which reveal those ideologies and those associated political interests. I'll get into more detail a little later. CDA as a methodology often connects language analysis to the study of society and supports the search for holistic and social meaning that is often hidden and taken for granted. CDA's ontological focus centers on the understanding that a person's experiences and outcomes are constructed by language and action, and it is that we call discourse. The subject can then be uncovered and understood in ways that have not been considered to allow for alternative meanings to be explored and adopted. And there are many different methods of investigation under the CDA banner. I'll talk about a few of them later. However, all forms of CDA are concerned with the power behind and within discourse. Therefore, CDA openly advocates for social change through political intervention. So returning now to this diagram briefly, I'm going to talk a little bit more now on the left-hand side. So here is an overview of some of the key players in the CDA space. Their approaches range from inductive in nature, so historical analysis and approaches, linguistic social actors, that type of thing, all the way down here to more deductive approaches, which are looking at dialectical relational approaches and socio-cognitive approaches. Now, there are newer iterations of CDA and nuances to it. A few examples off the top of my head: problematization by Carol Backey, and also how things become normalized in discourse by Krzyzanowski. So the role of advocacy in CDA is also sort of an area which is gaining more traction. But really, CDA is a fairly constantly moving, area of inquiry. But there are some common features which we see, and if we see those things, we would classify it as critical discourse analysis. And they are: the area of inquiry is problem-focused rather than paradigm-oriented. It has a focus on the relationships between discourse and society. It focuses on relationships of power, discourse, and society, looks at dominance and inequality. It looks at underlying ideologies, and it attempts to uncover what is implicit or hidden in the relationship between discourse and ideology. And it does this because we are all part of a wider societal structure, and the influence of power and dominance impacts our daily lives and how we live. Fairclough states that every action and occurrence of language contributes to the ideological constructs of the macro structure, keeping in mind that we often live in a micro, meso, macro epoch. And this means that what we know to be our societal ideals and our ways of thinking and acting are constructed through discourse, and this is often pushed down from the top and reinforced within society. So by the top, I mean political entities, but this can also be more local or meso, such as healthcare. So ultimately, we're all the micro players. So CDA itself is a theory-driven methodology. It stems from the positioning of critical social theory and that philosophical positioning that we discussed earlier. Your area of inquiry is considered in relation to its conceptualization and the way that it's operationalized in society and how it appears in the discourse. The specific discourse is subjected to analysis through various forms and is interpreted through the lens of your inquiry. And this is an iterative and cyclic process. There are often many rabbit holes to explore, many assumptions to bridge, and many ideologies to unpack. As an example, I've provided here the framework designed by Norman Fairclough, who looks at relational discourse analysis. As you've probably guessed, I'm quite a fan of Fairclough. I actually used the meso, macro, micro Fairclough's processes for my own thesis work and continue to use it in my postdoctoral work. I like to think of this diagram as if you are looking down upon a pyramid, and at the top of it is the text itself, which you may analyze for its descriptions and its other linguistic choices. It is interpreted in the context of its text productions and its consumption. So who wrote it and who the audience is intended to be. And at this level, you are processing the information based on its intended purposes and how it is being interpreted. The foundation of the pyramid, or that sort of lower level, is the socio-political practice, which is an analysis of the explanation of how the discourse exists within society. What conditions need to be evident in order for this area of inquiry, your area of inquiry, to be the truth within society? Why does it exist? And does it contribute to societal ideologies? Other frameworks may choose to focus on different elements. So, for example, I talked about Carol Backey earlier. That's that problematization discourse, which is where policy may simultaneously frame and solve a problem. And other frameworks might look at images, for example, and investigate certain ideals that pictures perpetuate. Let's give a little bit of an example here, because there's a lot of theory and a lot of concepts I've been throwing at you. So hopefully let's get it tied down to something a little more tangible. So my PhD was an investigation into the concept of person-centered care in relation to nurse navigators in Queensland. So nurse navigators are autonomous nurses who work with people with complex and chronic conditions and help them to manage multiple appointments, and their medical and social aspects of their care, or in other words, they help them navigate the system. Their first core duty is to deliver person-centered care. And if you're in healthcare, or even if you're a consumer, you've probably heard person-centered care kicked around quite a lot. But what does that really mean? Who is driving that? Why? What impact does it have on nurses and patients? And so there's so many different methods that we could choose to do in that area of inquiry. We can do document analysis. We can look at comparisons. And I did a comparison between the 2006 competency standards and the 2016 standards of practice for nurses. You can do mapping, you can do messy mapping, you can do genealogies and timelines, which is what I've done here. If I quickly talk you through this example, it's based on the work of Elizabeth Povinelli, who did a symphony of neoliberalism, which I just loved. So the symphony is supposed to look like music. This top stanza is where I have mapped all of the different documents, events, staple items related to person-centered care. Some of the examples of the Declaration of Human Rights, Engel's work on the biopsychosocial, Medicare in Australia, health service standards, etc., etc. Down the bottom, I did a similar journey, but for nurses, to see their journey of autonomy and practice and how that changed. And in particular, I was looking for things like navigation models and those type of things that nurses stepped into. What was interesting is that I also mapped some really key events. So, for example, the Patel case in Queensland, Australia, is a case about a medical officer who was operating on people who probably didn't have the license, jurisdiction, or skill to be able to do that. Lots of people were injured and some died. What they found through that inquiry was that nurses and patients did not really have an avenue to be able to escalate or advocate for themselves. And one of the key things that came out of that was the Partnering with Consumers standard and also Health Consumers Queensland. So that bolsters that sort of epoch, or that the conditions under which person-centered care became so bloody important. Excuse me, I'm very Australian. So in the middle here, what I did was I mapped the connections between nurse navigators and person-centeredness. And we can see that as a care trajectory, sort of coming from early 90s models, where navigators looked at things like breast cancer in the African-American community, all the way through to our Queensland navigators, which are still the only navigators in Australia at this point. So there's an example of a mapping and looking deeply into the historical, social, political climate. So Why use critical discourse analysis? Because every time we investigate these things, especially if you work in healthcare, you're going to be up against hierarchy and some form of subordination. I talked earlier about images, and this is a really nice example of one. So here what we're seeing is a female presenting patient, and she's in bed. She's subordinate to the staff who are overseeing her care that are standing above her. The room is clinical, tidy. The medicine on the bedside table indicates that the person is unwell. The head of the person is tilted to the doctor and an arm lays across her body. She's almost at the mercy of the doctor. The doctor here is male. He is a sharp figure. He is dressed in white with a tie and a notepad in the top pocket. He holds one hand of the patient and the other's in his pocket. He's almost quite cavalier. The nurse stands back from the interaction of the doctor-patient. She's a feminine figure, modest, with her hair covered by a habit. She is clean, diligently taking notes for the doctor. Her face is not seen. She is thin. Of course, this is my interpretation of the picture and may be viewed as a tad obvious or superficial. But the point I'm trying to illustrate, and pardon the pun, is that discourse comes in many forms and perpetuates certain ideals that we bring with us as we grow. Nurses no longer dress like this. Patients now play an active role, but the power shown within this history and this photograph is very much alive today. So why do we use CDA? We use it because we want to look behind the wicked problem. We want to ask why. It's an investigation of power and ideology, and it changes you as an investigator, as a researcher. CDA is not an easy method. In many ways, it's never complete. There are so many rabbit holes to go down, and it can be difficult to know where to stop. It kind of swings you on a pendulum where you come out of society and you think, wow, I was really indoctrinated. And you may almost feel a little bit like a conspiracy theorist. So we often say, get your tinfoil hat ready. But rest assured that you will swing back in to society, but with a new understanding, and an understanding that history is really important, and understanding that the socio-political epoch or the history of where we stand is really important to how we move forward. Let's talk a little bit about power and equity. So CDA is concerned with power. So specifically though, power in CDA is a relationship. It's not owned. Foucault once said that a king in the desert has no power. Power can only be demonstrated through the relationship within which it is enacted. If there's no one in the desert with the king, he has no power. And I alluded to this earlier, but we as citizens are in many ways indoctrinated into our society. We assume the roles that society allocates to us. I asked you earlier to think about some of your roles. Here are some of mine. So for example, I identify as a woman. I assume the gender norms associated with what is accepted to be a woman. I'm a mother. There is a script associated with what that means, and I too comply with this for the most part. I am a nurse. My virtue script is strong. The system tells me that it is what it is to be a nurse, what my identity should be, and thus we perpetuate what that means from within. It is difficult for nurses to act otherwise. When we start to think outside of the defined parameters, the world can become very uncomfortable and we can become frustrated and jaded, that pendulum swing. Of course, it's also perpetuated from outside. Other professionals perpetuate the role of the nurse in the system. The system and the structure designs itself around how they understand the nurse to be, or what it is to be a nurse. And this can be true for any social group within society. Many times, this can lead to oppression of certain groups, and at times that makes people move into resistance and at times violence. Power and equity is also, largely around that hierarchy. I just want to dig a little deeper into that. So in healthcare, that's definitely the case. And this picture demonstrates perhaps a male dominance of, a healthcare structure, but it can be applied to the leadership of healthcare, but also, sort of a systemic look, or if we think about it as conceptual look of how healthcare is designed. So if we think about it, the healthcare structures and supports, they look at the levels of care, the access, the funding, the resources, and the staffing that are required for all those different areas within healthcare. And we only need to look at the under-resourcing in rural and remote areas for examples of how things can be inequitable. So power is also structural over people in terms of how they can access care, the avenues to advocate for themselves, the coordination of the system, having specialists talk to one another. That's all really, really limited for the consumer who's trying to navigate this system. And it's by design a very linear system. People come in, they're seen, and then they exit the system. And the funding cycle is then complete at the end of that linear process. So you can see why a system would be geared towards that linear sort of understanding of it. But of course, the reality is that people are now living with more complex and chronic conditions, and seldom is healthcare a simple in and out process. Far from it. I also question, how can you be at the centre of the care when care is not a circle? So turning our minds now to opportunities. We ask, what might CDA do for us as researchers, or what could it do for the consumers of care or for the workforce or whatever area you're investigating? CDA is looking behind the curtain. It's looking and digging deep. It's understanding what is happening at a time which instigated or drove certain issues into existence. It understands the political and social motivations of those issues. It allows us to track change, make associations across the social, cultural, and the political epoch. In healthcare, the application is important. It is about understanding deeply ingrained truths which provide insights into why certain structures exist. Here are some examples of the work that I've done postdoctorally after I did my investigation of person-centeredness. Firstly, nurse navigators and person-centered care delivered but not valued. In this article, I looked at how nurse navigators were clearly pushing boundaries, working at the margins of healthcare limitations to deliver person-centered outcomes. But that wasn't always necessarily appreciated or valued. Often, we only see value in terms of healthcare costs. Understanding the impact and causes of failure to attend, a discursive linguistic study that looked at the impact of what it means for people to be called a failure to attend. And that's a really powerful piece. And we advocate for a change of language in that particular article. You'll see other examples such as failure to progress in the birthing suite and other oppressive language. My most recent article is discriminative and exploitive stereotypes. And I used artificial intelligence to generate images of aged care nurses and looked at the impacts of what that demonstrated and how that impacts on recruitment and retention of aged care nurses. So hopefully you can see now that critical discourse analysis allows us to look quite deeply into things and to really advocate and to critically apply our skills to what is happening in healthcare. So I've come towards the end of my presentation, but I wanted to provide you a brief summary of this presentation and also the take-home lessons for CDA. So CDA allows us to understand the historical, the political, and the social areas and influences that impact on an area of inquiry. It understands the relationships and experiences of people within certain social orders. It's particularly geared towards those who are less fortunate or the inequity that we have within our society. It understands that deep changes are required. So often we think about solutions in healthcare without taking a moment to step back and think about what it is that what we've brought with us from our history and what needs to change, or how deeply ingrained something might be. And I believe that CDA really allows us to do that. Certainly, it does not offer a quick fix, and it's not the easiest of methodologies to get your head around because it is so densely theoretical. But certainly, it allows for you to express your passions, to investigate things in ways that you never saw coming, to run down a rabbit hole, to float in the ether. It's quite a beautiful methodology to be a part of. And I suppose what it allows for us to understand is that power is not owned. It is really complex. And that gives a sense of advocacy in healthcare researchers. And me as a nurse, I really take that very, very importantly, very, very personally. It's a very important thing. We need to make sure that we are holding health services and systems to account, and that we as nurses, for example, but whatever area you work in, are working to our full scope of practice and being utilised as best we can. And we have the power in the relationship to be able to do that. Here are my contact details. I'd love for you to reach out. I love speaking with people about critical discourse analysis, and I love being interested in projects. My door is always open. My email is abyrne, BYRNE, @cqu.edu.au. Thank you so very much for your time and for listening to this presentation. I can't wait to see what the rest of the conference brings and to speak to you guys very, very soon. Thank you and have a great rest of the conference. See ya.